See me,
Hello.
see Elizabeth. Hopefully you can see us both at the same time because together we are Clinical Alchemy.
I'm
And
the clinician.
yes, doesn't she look? She looks very clinical, very smart. Yeah. And I'm the alchemist. That's why I have a rock coming right out of the top of my head because I am divinely connected to terra firma. So, Elizabeth and I have been doing a series of these podcast conversations because we want to really help you guys become fishermen in the cannabis industry so you can take care of yourself. And my super smart friend here, who, those of you in the know call her EMAC, is a RN and has done a lot of cannabis research. And this is just one of the great books that she wrote, How to Become a Cannabis Health Nurse or Coach. She's a coach, yes. Or you can't, you know what? Elizabeth, I met one of your nurses this week, Nurse Grace. Elisabeth has some amazing cannabis nurses working for her. For you people who are out there, and like this conversation is going to be near and dear to a lot of you because it's about taking care of our family members. And sometimes we just need a little bit more assistance. And Elisabeth and her cannabis nurses are just the people to reach out to. So we're going to have all of that information for you in the feed. But back to this great body of work that we're going to be working off of. We're going to be talking about our elders. The most shocking part of the conversation is you and I are elders. Yeah, we have we have ARP cards. So frightening.
I
How
do.
is it possible?
I do. And now at 55, I can go live at one of those senior communities. I can finally get in where my mother lives.
So it's shocking, and that's also the beautiful thing because like there's this picture going around Facebook of these really hot mamas from the 70s, and they're all like in their bell bottoms, and they're standing by a Dodge Charger, and they're just looking so hot. And the caption above it is, "These are your grandmothers today. This is what your grandmothers looked like in 1970." So we're so cool now when we're old, we're not like fuddy-duddies like our parents, we're not depression era, we're hippie era. All of the people that are aging now, they're all like Abby Kaufman and, Marching on Washington and Bernie, what's his name? Sanders, Mr. Mittens.
Bernie Sanders, yeah. Well, and then there's another Bernie. I saw on my CNN news alerts today that Bernie Madoff died today in prison.
Oh yeah, poor Bernie Madoff.
So I support Bernie Sanders, kinda. I mean, there's good and bad with everything, right?
Right. There's good and bad with everything, and in elder care, some of the stuff, like taking care of seniors, leads to elder care, and cannabis is just a wonderful thing that can help us carry our parents and loved ones and ourselves, crawling towards those numbers. It's all an uphill climb. So cannabis is really helpful because why, Elisabeth, is cannabis helpful?
Well, it'll help us age more gracefully. I mean, think about like when if you've been listening week by week, when we talked about the endocannabinoid system and how it modulates all of our other system. And what that means is it activates, it fine tunes, right? So this plant interacts with receptors all over our body. And what they do is it brings back homeostasis or balance. Think about the Goldilocks zone. And as you age, the endocannabinoid system works less and less because it's like your telomeres are shortening. You have all of this stuff, you're breaking down, right? And the endocannabinoid system breaks down along with it. So if we supplement, like you take vitamin D, omega-3s, some good B complex, and etc., right? You can fine tune this with cannabis supplements so that your ECS continues to work. Because guess what? If your ECS continues to work, then you have less aging breakdown, and you probably look a lot better too.
Look at us. I mean, I'm 102, so, and I'm still standing, still going for it. So that's the great external thing, is that you look great. Cannabis really does. It is the fountain of youth. And the more you use it, the younger you look and the more youthful you feel, because, really our age is determined by a number of things, and, diet, environment are part of them. Stress is a huge part of them. And something happens, I don't know if this happens to men, but I'm pretty sure it happens to every female I know. Somewhere between 48 and 55, You stop sleeping. So Elisabeth just did this whole, if you guys missed it, maybe you can, we can drop the link in to go back and hear it. Is it already ready to be heard again, your broadcast?
It'll be on my website. I don't know, sometime maybe Monday.
Okay, so you're going to want to circle back to holisticcaring.com because Elisabeth just did a whole teaching earlier today on CBD and sleep. So why don't you just like go over all of that again, because it's really hard. Well, let's talk about it. Like sleep is something that's really important to all of us. And, you know, like it's difficult because of hormonal reasons, right? That stops our sleep, right? As does age, you know, when sundowners comes or, you know, we get a lot of anxiety as we age. And this is a great way to.
Well, right. Yeah, when you think about the ECS and its potential to help reduce anxiety, right? That's the number one thing. Like, why does CBD help us to reduce anxiety? A couple of things. CBD inhibits FA. That's an enzyme that breaks down anandamide. Anandamide is our own endocannabinoid, and I've talked about that a lot. Anandamide and 2-AG. So if we don't have all the enzymes breaking those down, we have more in circulation. Very similar to when you take an antidepressant like a Zoloft or a Paxil, it's helping you keep more serotonin in your system. CBD helps you keep more of your endocannabinoids. And when they're all working, you feel good. Part two is CBD directly activates 5-HT. That's the receptor that helps you make serotonin. Serotonin is what keeps you nice and calm. It's your happy hormone, nice and balanced, not anxious, not depressed. It's your happy zone. And so CBD helps you make that. CBD activates all these other receptors as well, but just those two can really help. And then for analgesia, CBD is anti-inflammatory, so that can help you sleep if you're not hurting so much, right? So
yeah, that's a start. And that's another. Okay, so sleeping, it's CBD. I can't even get the word out of my mouth, man. Maybe I need some of it. Is there a way to like grease my jaws with CBD? Sometimes to go to sleep, though, you need a little bit more than just CBD.
Correct.
Especially if you are in pain. Mm-hmm. So now so that leads us to, I don't want to get my mom high. I don't want to get my grandma high. So how am I going to, what formulas are going to work for me with let's say my grandmother has, you know, Alzheimer's and, suffers a lot of that anxiety that comes with that because they're in and out of knowing where they're at. You know, that's very anxiety producing. What kind of dosing and product is helpful for that?
Well, you start from a harm reduction standpoint, from a clinical standpoint, you're always going to want to start with CBD. Like think about like a 20-to-1 or a 10-to-1 or even a 4-to-1, right? So, and what I'm talking about is CBD to THC. I'm not a fan of isolate, but you know, I like a good full spectrum plant CBD. And so as far as dosing on that 10 milligrams, 5 to 10 milligrams of that 20-to-1. And so what does that look like? So 0.25 in a dropper. Remember the 30 milliliters is 1 fluid ounce. And if you have 600 milligrams in there of CBD, each dropper is going to be 20 milligrams. And if you take half of that dropper, that's going to be 10 milligrams. So you can
We're talking about trace amounts of THC. And that's the main reason why people are not getting really high and why it's super effective is because it's just enough to calm and quail that nervous system.
Right. Yeah. Like with your Blue Buddha CBD, that's going to be, you know, basically a 20-to-1 sort of CBD. It's a high CBD, just trace amounts of THC. But if that's not going to work, then you fold in THC, right? So that would be the starting point, but then we can drop down to the 4-to-1. And so the 4-to-1 is still high CBD. It's not going to have psychoactive effects. You're going to feel nice and calm and relaxed. And with more THC in there, you're going to be more sedated. So now let's talk about timing, right? The CBD alone, you could take it before bed, but in small doses of CBD can be energizing. It can actually make you more alert. So most of the time I start people with CBD in the day. So sometimes in the morning, sometimes in the afternoon. The afternoon is a good time to try because if you get a little bit tired, you could take an afternoon siesta. If you find it's energy and you can energize and go
Right,
take
you can get something done for the rest of the day, right?
go
You
take a
know, I
walk.
know when our cannabidiol products, especially for sleeping, are infused with other things because of that neurostimulant effect of CBD, where you get a lot of energy. You know, we use a terpene profile and a couple of essential oils to just kind of like, that's the wonderful thing about cannabis. I just have to share this as an alchemist and an herbalist. All of the plants, they all sit in certain places and they all have different properties for us. And our teacher plants are things like cannabis, peyote, ayahuasca, psilocybin. They sit in the center and they actually like spin the wheel. So they are able to take things like frankincense and myrrh, or something like valerian root or skullcap, which is great for sleeping, and like just put jet fuel onto it and bring out that plant's undercurrent so much stronger. And fix your endocannabinoid system, which will make you look better and live longer.
Yeah. So tell me more about like the Blue Buddha CBD. What are some of the terpenes that might be in there? Would it contain linalool? Because linalool is a terpene that's nice and calm.
Yes, that is that for our sleeping. That's part of it. So for people who don't understand the technical names of terpenes, let's just, this is sort of off topic, but really important, because a lot of products that people are going to get for their loved ones and their seniors are going to be things that they're picking up at dispensaries, and they're going to have like infusions in them. They're going to have that kind of stuff. So when it says like it's a green crack terpene, it's actually just a pine terpene. It's from a pine plant. So everything has terpenes in it, and terpenes affect our olfactory resource. So they get our whole system to fire up. And that's why when they're used correctly and they're like fortifying the cannabis, they're really magical, really, really magical.
Yeah.
So it's a good way to help treat your family. So let's say I have had a client. I had a client. Okay, let's just do some client. Like, let me give you a client case, Elisabeth, and you can see where you would go with this. So, woman calls me up. She's like, my mother is 87 years old. She hates being in a nursing home. She's biting everybody. If you get close to her and go out to reach her, she's going to bite you. So she's bitten like 4 or 5 orderlies. She throws things at them in the door. She's super aggressive. She's 4'11" and she weighs 98 pounds. I don't know what to do.
Any idea what pharmaceutical she's on?
She is on no pharmaceuticals.
Oh, wow. Okay. Well, has she tried CBD before?
No, she hasn't. They haven't tried anything with them at all.
Yeah. So we could start with just CBD, right? Like your Blue Buddha CBD. But somebody that's very aggressive, you might want to just drop right down to the 4-to-1, right? The 4-part CBD.
How do I dose an angry lady? How do I dose my angry parent who weighs literally under 100 pounds and is 4'11"?
So a couple of things. So I would still start with that 4-to-1 CBD to THC ratio, and I would use 5 milligrams. So in your medicine, that 20 milligrams per mil, I'd take 0.25, right? So drop that in. You could put it right under the tongue in a sublingual dose. You could drop it onto a cracker. Couple of different ways of pharmacokinetics there, and you might want to try that in a couple ways, because if you drop it straight into the mouth, you're going to have more of an immediate effect. If you drop it into a cracker and have her eat it, then it's going to go through the digestion in the stomach. But both are going to be doing good things to reset and balance out this system. And hopefully when the CBD gets there, it's going to help activate some serotonin, activate some anandamide. The THC is going to decrease some of her pain, maybe at 87 and some confusion. She's not verbalizing what's really going on in her. You can't articulate things. My mother's 86, like, half the time she's anxious and she's not talking about things in always 100% sense, right? And I also think she's editing because she doesn't want to worry me. right? And so you never really know what somebody's really feeling, right? So I don't tell people they shouldn't use THC because they should. A lot of them, but on a micro dose, if we have 5 milligrams of a 4-to-1, what is that? It's going to be basically 4 milligrams CBD, 1 milligrams THC. THC is not going to be too much for an 87-year-old, even at 100 pounds. And make sure she's well hydrated and fed. So that's the other thing. You want to put this in the body with some food. It's going to help it activate and boost into the metabolism. And it's also going to soften any of the effects from THC. And she might get hungry,
And then she might get to 97 pounds. Right?
Yeah. She's 96. Yeah.
Or she's 87 actually. So, okay, I think it looks like we have a question. Let me put on my glasses because like I said, I'm 102. Okay. Wants to know, would you recommend for elders who are struggling with depression and apathy? Well, that was going to be my next case study. Okay. Okay, so here's our next person. This is so fun. I love just throwing these random, okay, so here's another person. All right, it's a woman and she's in her 70s. She's a good 50 to 70 pounds overweight. She is stage 3/4 ovarian cancer. And she's very depressed and doesn't care. She just doesn't care about it at all. And she's eating a lot of sugar because she doesn't care. So she's just like, whatever I want, even though we try to maintain her diet and help her that way, she just sneaks food.
Mm-hmm. So, well, this is not going to stop with the plant, right? So I will use the plant to bring in some lifestyle measures, right?
And that's really important what Elisabeth just said. The plant is not going to fix the scenario that I just gave her. It's only going to accelerate and help and direct the process.
Yeah, I mean, just like pharmaceuticals with somebody that's depressed and apathetic that is not practicing self-care is not going to benefit her either. Right. So how do we bring this together so she can find whole person well-being? And that is tricky. So I would start with essentially even just the 4-to-1, right? So decreasing some pain, increasing some energy, still sticking with that 0.25, very small doses. So 5 milligrams in the morning. I might give a second dose of that in the afternoon. And what I'm going to try and get her to do is pair that with some maybe journaling in the morning, pair it with some meditation, some breath work to open things up and talk about purpose. One of the things I love to do, especially with seniors, and this is just a coaching technique. What are you living for? What gives you hope? What are you looking for?
I'm not living for anything and I don't care. And I agree 100% that when someone answers a question like that you just ask them again, what is it that you love? What is it that you love? I think that elders, I want to just kind of really get off the freaking pathway here and go down another vein because it's really important with the depression and anxiety when we're speaking about elders and just older people and really people in general. We have other plants that are super helpful to us. And one of them is microdosing psilocybin. So something that I like to, when I'm working with my senior population, especially when we're getting closer to end of life, or we're dealing with people who have late stage cancers and are just forget it, I don't care. Psilocybin, which is, found in a variety of different mushrooms, very instrumental in helping lift that veil and make those neurons connect a little bit better and find that lightness of spirit. So, and they work very nice together, cannabis and psilocybin.
Mm-hmm. Yeah, and the psilocybin, you want a microdose. So I know you have 1 gram and half a gram and just things that are different availabilities. But with seniors, I had a guy up 90 years old. It was taking about 0.25 milligrams, right? So barely nothing. Once a day, every noon. And that was really moving the needle on pain, a serious end of life cancer pain. But he was also very depressed and very angry. And that just changed that emotional spirit because it opens up dopamine. It opens up, it basically resets your neurotransmitters in a way that is very
nothing else does.
Yeah, like nothing else does.
Right,
But
nothing.
back to the lady also that if we're just talking about cannabis, so I would use a couple of 4-to-1 dosing. I'd see about sleep, right? How much is she sleeping? Because some of the time that's a real problem, and she's not getting good restorative sleep, which is where we heal. It rebuilds the immune system. It rebuilds bones and helps us to rest and restore. So maybe a 1-to-1, more THC at bedtime is going to help her get better sleep. But we want to give energy, and if the 4-to-1's not working, then let's pull in a vape. Let's take a 1-to-1, especially if she's cannabis naive, but use those like the green crack type of terpenes, right? So that's going to be pinene, limonene, energizing. Take a puff of that and then go outside and work in the yard. Talk to the plants. Be with nature. That resets you. It opens things up. You get to see the clouds and the blue skies and see if that starts bringing somebody back. And then take another puff of that when your spouse or kids come home and you're listening to them storytell their day. Engage your senses, engage your mind, engage your heart. Cannabinoids open up the heart. It's not just activating these receptors in the body. They help also unwind the mind and then open up the spirit. So it's amazing when you really layer and stack on these different products. I would be using a CBD during the day, 1-to-1 to get better sleep. And then microdoses of, sometimes you can get a sativa tincture, take like 2 drops, or you can get a sativa blended.
We do a sativa vape pen and a sativa tincture for sure, because like sometimes you just need to go up the ladder and not down. And cannabis on its own is very, like leveling and can be very, the more you use, that can make you more tired. So terpenes definitely have a place in. Since we're talking about people who are from the 60s now, in their 60s, right? So all the hippies are all around. They all, there's a lot more I want to smoke weed kind of stuff going on. And smoking flower can be a little aggressive on the lungs. And this is where vaping a FECO, a fully extracted cannabis oil, is a much better choice. And it's really good for, like Elisabeth was saying, get your granny a vape pen, let her hit some CBD with, like we formulate ours with sour diesel and Durban poison. Those are 2 of my favorite terpene profiles, and they're super uplifting. And then get her outside.
Yeah. So that's that is a key.
Okay, so let's talk about somebody. We were talking about all these really great, good, feel good kind of stuff, and it's always nice to get. Now I have a 3rd one for you. Are you ready? One more.
Okay. One more.
Okay, it's a man, and let's say he's mid-60s, hard job. He's on 10 pharmaceuticals. He's on everything from cholesterol meds to heart meds to blood thinners to mood elevators and sleep and narcotics. So let's just say he's just taking a little bit of everything. And he's cannabis ignorant.
Okay. And so, starting points.
So he's in pain, he's not functioning, he's uncomfortable. He can't really get out there and work in the world because he is so physically uncomfortable, and he's afraid to give up his narcos because what happens if it doesn't work? And the rest of his body isn't functioning because he's been doing heroin derivatives like morphine. Now what?
You tread cautiously as always, right? Start low, go slow. Remember your less is more, but also don't worry about using cannabinoids too much with the other pharmaceuticals in the beginning, because I like to run them side by side, but also with really fastidious tracking. So make sure that you are tracking each and every day where you are on the gauges in your body. So I have a tracking log, 1 to 10. Where are we at on pain, anxiety, memory, focus, mood, energy, sleep, and then blood pressure and blood sugar, and then the dosing of what you're taking, right? And so we have all these variables that we're looking at And you can then draw the correlations like, okay, blood pressure and blood sugar, those are the first things to, and people aren't necessarily measuring them at home. I always tell them, get a cuff, make sure you're doing your daily blood sugars if you have diabetes, because cannabis can alter those things. And we want to just always be cause and effect, fine tuning. This is meant to bring you into better health and well-being, not to give you complications and side effects. So, but the other key thing with anybody with a boatload of meds is that they need to be talking to their provider. Okay, they need to tell their doctor that they're using cannabis and CBD oils, and that they would like their participation, because some of those other drugs might be able to be reduced once the cannabinoids start working. And think about like a week where you have all of them together, and then week 2, you're going up on the cannabis a little bit and saying, what could I maybe reduce there? If you have pills that are scored, maybe you can break them in half. But you have to also be tracking and checking in with yourself. One of the hardest things to get seniors to do is learn how to read their body, because, you know, for 70 years, they've just been taking a pill and trying to get that immediacy. But that's not how cannabis works. And
no, but one of the beautiful things about using plant-based medicine is that it immediately puts you back into your body. It's a homeopathy, and something has happened. Oh, are you screen sharing?
Yeah, because I haven't done any yet today. So I wanted to pivot to a couple of these, because some of this is what we're talking about.
Okay, but I still have some like really important questions. Okay, so we can go over your little slide right now. Well, let's talk about what it does.
Yeah. So, and also think about why seniors have the most to gain with cannabis, right? Because this is, you know, it improves peace of mind with the aging process. Some of that is in the amygdala and the hippocampus. It's helping to get rid of memories and thoughts that are negative about yourself, and improving your peace of mind, reducing pain, inflammation, strengthening bones for osteoporosis. Several of the cannabinoids do that. That bone-on-bone pain, I can't tell you how many seniors they've got degenerative disc disease, and that their mobility is decreased. If we can turn down some of the pain signaling, you need THC for that, but we can help some of this. Low doses, THC and CBD, of course, but even low doses of THC improve cognition, enhance focus and engagement. Less insomnia, depression, anxiety, isolation, and fear of dying. These are things that we need to work on with our seniors, depending on where they are in this process. But all of them need to start talking about these. And then think about the pharmaceuticals. So when we're talking about the drugs and the boatloads of drugs, a lot of these work really poorly for seniors, and they're also really meant to be short term, right? How many people are on drugs for years and years and years, and they're not getting efficacy, but they still take them because they don't have any alternative?
So are there any drugs that are contraindicated with cannabis? Like, is there anything that you should not be taking? And can I take my pharmaceuticals and my tincture together at the very same time?
I like to use the pharmaceuticals first. So take the pills. Let's say 8 a.m. is your morning, 7 a.m. wake up, 8 a.m. pills and some food, and then 9 a.m. or 9:30 tinctures. I like to space it 60, 90 minutes, because when we're processing through the liver, all of these pills, the CBD and the pharmaceuticals kind of compete for processing enzymes in the liver, and CBD tends to hog them. So we want to put the pills through first and let them start to clear out, have some good water drinking, and then take the cannabis, right? But SSRIs are one of those that we want to pay attention to. What would this be? A Zoloft, a Paxil. This is the selective serotonin reuptake inhibitor. This, if you get too much
I love listening to Elisabeth, like how she just spewed that out of her mouth. Serotonin inhibitor.
Yeah,
wow.
If you take too much
you know what that is? Does anyone know what that is? Do you have that in your brain? Do you know what that is? Where is that in the brain, Elisabeth?
Zoloft, Paxil, Prozac. You know, there's lots of them.
There's lots of them, and a lot of people don't know what they are, and they don't know what they're doing, and they don't know what part of the brain they're functioning and what part of the brain they're withholding and how exactly that works. They don't understand. So many people are taking pharmaceuticals, and they have y'all have no clue what it's doing to the brain chemistry of your brain. You know, it's changing.
We talk about cannabis changing your brain chemistry. Well, some of these pharmaceuticals do too.
Changing it more. And so what cannabis actually does is it helps your brain come back into harmony. It helps your brain come back into alignment. And then you don't need these things.
Right. So if you have the SSRI, if I'm taking Zoloft and I'm taking a boatload of CBD, they're doing the same thing. They're helping me with serotonin. So I don't need both. So what we need to do is tell the clients, don't take as much of the SSRI as you start going up on the CBD, because they're going to be doing similar things and you don't want to get too much of this.
So like, again, this is a lot of information that you're giving us. Now you have a module, don't you? That's just for seniors in cannabis. This is something that people can reach out to you at, like, specifically this topic, working with their elders and cannabis medicine. You have one of those things, right?
In the patient programs on my website, I address a lot of these issues with seniors in the modules that talk about Alzheimer's, Parkinson's, MS, a little bit about chronic pain and cancer. But really in these, we talk about the aging issues. So, but it's all the same thing.
It's all interwound. You do not have aging issues without having conversations about pharmaceuticals and things like that. It's all.
Well, you know what? In the course that I have for professionals, the licensed cannabis health coach and the cannabis health coach certificate, both of these have an entire module on geriatrics and pediatrics. Awesome. So I don't have a patient program specifically on geriatrics.
No, but all of you who are in healthcare who would like to have more information, yes. This is a really deep dive into that. And so so it's really easy. Like I'm always very cautious to tell people, about like weaning off of their pharmaceuticals and making other, and using more cannabis and less Zoloft. So how I think that you should talk to the person who gave you your pharmaceuticals and get a program on how you're going to dose down and dose up.
Exactly. Because when we're talking about pharmaceuticals, there's something called the Beers list. And this is a list of pharmaceuticals that do more harm than good. And a lot of these are on it. NSAIDs like Motrin causes stomach bleeding. Even Benadryl taken by seniors really increases fall risk, dehydration, and other things. And then aging, it decreases the absorption in your renal and liver clearance rates. So anytime you put medicines in you, you can have a higher degree of toxicity, especially when there's dehydration going on. So, when we think about these complicated aging issues, think about all of these things: anxiety, depression, chronic pain, appetite, sleep changes, relationship issues, metabolic syndrome, hypertension, etc. Right? How many pills are they on? This is what we call polypharmacy. And that's why I saw somebody in the chat, somebody's taking a boatload of drugs. Well, UCSD did a study. They have all these dispensaries like a couple of blocks away from their UCSD Thornton campus in La Jolla. And they've got a division now that is studying geriatric clinics care at UCSD. And they're starting to ask all of the seniors coming in, are you using cannabis? What are you using?
They're all saying yes, because they were all 22 years old in 1970.
Well, yeah, the thing is, they're getting more used to it, but they're using it for anxiety. They're using it for pleiotropic reasons, multiple conditions, arthritis, neuropathy. CBD is very helpful for neuropathic pain. And what else touches that? A boatload of gabapentin, but that has them all snowed. Right?
Oh my gosh. Can we just talk about gabapentin for a minute and how much I can't stand it? Like really, there are so many people out there on so many milligrams of gabapentin, and gabapentin is a huge blocker. It is not only blocking you from pain, it is blocking you from life. It is blocking you from your dreams.
Yeah.
Sorry.
Well, and these people they're numbed out, but they, 70%.
Exactly. Listen, everyone.
Imagine 70% of the seniors going into the geriatric clinic at UCSD saying it was helpful. That's beating placebo every time. But there are still stereotypes, and this is what we need to overcome. They need to know they do not have to be high. They don't have to smoke anything. They don't have to lose control. And that this is going to help them accomplish better goals, better sleep, less pain, less anxiety, more connection. And, the whole thing is that you got to dial it in. You have to take the time, experimentation, patience, and money. And
And
what's
well, I mean, and also having, the wonderful thing now, I mean, like, 10 years ago when, we were starting this stuff, there weren't people like you around that you could reach out to and get some assistance with. So, nothing happens overnight. And sometimes people see cannabis as this, like, they have this imaginary thing that they're going to take one tincture, one gummy, and poof, everything is going to be better. And pharmaceuticals do a lot of damage to your liver and your kidneys and other parts of your body. So there is a lot of restoration that has to happen that cannabis can and can address. And the sooner we can get you off of pharmaceuticals and into plant-based medicine and having a healthier lifestyle, guess what, folks? The more money you're going to make, because you are going to feel so good. And all of your cash isn't going to be going to the doctor, and you're not going to be like a slave to that job that you want to quit because you have medical and you need to get your pharmaceuticals. So as you begin to care for your parents, remember that right now, all of our elders pretty much are folks from the 60s. They were happening in the 60s. So they're a lot more open-minded, and it's a wonderful time. I've had a lot more doctors be a lot more open, even in states that it's not necessarily legal, to have the conversation with. And I always say to people, make sure you let your doctor know that you're using CBD products. It's not against the law.
well, and why don't they want to talk about it?
Well, because why? Because their parents are apprehensive to even like talk to, they don't want to, because your parents were 22 in 1970 and people were going to jail for a joint. That is why your parents are apprehensive in talking to their medical provider about cannabis, because their mentality, their education, their life experience dictates that they will go to jail and it will be bad. So you just need to keep circling back to the reality that it's a changed world, and go slow with your folks. Like, we're slow now. We need to hear it more than one time.
Mm-hmm.
Show them shows on Netflix.
Yeah. So let me go back to this. So when we think about, look at that smile, right? That is the result of talking to your providers and your kids and everybody, because the providers can help you dial in, not necessarily your cannabis dose, but they can help take away the other things that you're on. When we talk about talking to your provider about CBD, they have to understand cannabis is medicine. Providers understand that patients want to use it. This is like still stepping a toe in uncharted.
Right. And also, just right here, I have to interject this. Remember, you pay your doctor. Your doctor works for you. So if you do not like your doctor and your doctor is not on board with your healthcare, change your doctor.
It's a good point. Like, most of these people have this paternal relationship or so with their provider. They think the doctor is like a parent, and they're just so cautious about everything they say. And it's like, but when you think about cannabinoids affecting other pharmaceuticals, so what are some of the other ones? So we talked about SSRIs, antidepressants. What about blood thinners? How many seniors are walking around on Coumadin or Eliquis or any of these other things?
What about, this is a really important place to stop. What about Coumadin and cannabis? Because something needs to be said about that particular pharmaceutical.
Well, I'm sure you've heard that it can influence the INR. Basically your clotting factors, the way that your blood clots. And for people that are on Coumadin, they're generally trying to avoid blood clots, right? So they've had a clot somewhere and they need to stay on Coumadin because their blood gets sticky at a certain point, and it's clotting, and those can be dangerous because you can have a stroke, you can have a heart attack, you can have a pulmonary emboli. And so these people are walking around on Coumadin. Now, it doesn't mean you can't take CBD, but you have to introduce CBD very slowly, titrate it up very slowly, and get the monitoring of the INR. You have to keep, and those people are going like every 6 weeks anyway. So initially you might want to go every 4 weeks, or at least every 6 weeks, but really also scan your body. Am I showing any signs of anything that is, an issue? Am I having bleeding? Because what if it's increasing the INR and they start bruising? You have to be in touch with your body and see, wow, I'm bruising now. The CBD might have changed my levels. Let me call my doctor and get a test. And then what's the deal? It's not like you have to give up the CBD. No, you decrease your Coumadin. That's adjustable. You want to continue the CBD because guess what? Maybe at some point you don't need the Coumadin. It's not necessarily like they're doing exactly the same things, but CBD does so many different things in the body that it might help equalize some of the things that went wrong, causing the stickiness in the blood and the inflammation, because that's inflammation. When we think about inflammation, why are you getting clots in the first place? You've got all of these blood cells and immune cells floating through you, and they get sticky, and that's because of inflammation. Inflammatory things start something, and then everything follows, and it's like a snowball going down a hill. When CBD gets into the body, you can start to break some of the cycles, because remember, it's a homeostatic regulator. And if we can start to bring balance back to the cells that were the original offenders, now we can get rid of that inflammation. Do you remember my shoulder when I first met you, probably back in 2016?
And we talked about it in our very first podcast, your shoulder. So bring it back here to the third.
But my shoulder is moving. I've had 3 shoulder surgeries. I've had ligament reconstruction, rotator cuff repair, impingement syndrome, clavicle reduction, and I've got 3 pinched nerves in here. When's the last time I had a Motrin or a Flexeril? Gosh, I think it was last weekend when I did some yard work. I partied and I took a Motrin. I mean, it's crazy. It's really crazy, because it
really is crazy. And for all you folks who don't know this, this woman, she does 4 times the amount of work that a normal human being does. So for her to put that much stress on her body every single day without even thinking about it, and a lot of her work is that fine motor skill movement of typing, which is very, a lot of pressure up on the neck and the rotator.
But this inflammation has eroded. I have functionality. I don't have heat. I don't have itching. I don't have pain. I don't have contracture. I'm able to do my
restoration. Your shoulder has been restored by the use of cannabidiol on
a daily basis.
Yeah,
so, and this also is like, how long do I need to take it? Well, as long as you want to feel good at 55, right? Yeah. I'm not going backwards, but going back to this, providers can learn about CBD. There is so much on PubMed, the repository of all of our data. And then this guy, Peter Greenspoon, you could look him up, follow him on Twitter, Facebook, LinkedIn. He's a professor of medicine over at Harvard Medical School. And he works at Mass General.
And he's a member of the AARP, so we can go get a meal discount with him.
This was from the AARP bulletin. I have the hard copy over here somewhere. But he was quoted to saying it makes sense to try cannabis when you consider the track record of other medications older adults take, especially for pain, sleep, and anxiety, because look at what the NSAIDs do. Your Motrin, your Aleve, they cause all of this stuff, GI bleeding, heart and lung issues, and kidney. Opiates should not be taken long-term. That's meant for like 5 days, right? People are on them for years. And you know what? People that take opiates for 30 days are 50% of them stay on 3 years. That's the insanity of this. And then hypnotics, Ambien and benzodiazepines, people can't even get those anymore. So they're all just sitting there saying, well, what do we do? And this is my final slide. You start here. You start here, right? Because
because the Buddha will bring you peace to your central nervous system, and once you have peace in your central nervous system, you have peace everywhere.
So yeah, I mean, is it this or is it this? And then where are we? And a lot of this is personal preference. Think about all of the people that are a lot of it also has to do with money. Because how many people won't go out of their insurance-based program to pay for something out of pocket? They don't want to take supplements. They don't want to go to chiropractor and acupuncture. They don't want to meditate and do anything like that to calm them down. They don't want to go to yoga. All those things is what keeps you healthy. They don't want to see a nutritionist. Come talk to me. I will teach you how to eat well.
Ultimately comes down, folks, to personal responsibility. It really, no matter what is going on in your life, you have to assume authority and take responsibility for yourself and your life choices. And the more that you do that, the more autonomous you become, the more powerful in your person you become, and the greater manifestation of life you have. So one of the things that's really challenging when you're taking care of your parents is that they're your parents. And That's a whole lot right there. So sometimes you just want to like put your parent out. Like you just need a break. Like you're like, wow, I have all of this trauma from growing up with you, and now I have to take care of you. Cannabis will also help the provider, the
Yeah.
caretaker, you, the caretaker. You know, I'm very fond of saying in my practice that the caretaker needs the most care, because the person who is the caretaker, because I'm sure there are many caretakers listening right now to us, is the one who is doing 10 times the work, because you're taking care of yourself, and then you're taking care of your loved one, and you're more than likely managing a job or another family member. So, you know, healer, heal thyself. Drink from your own. You got to have your own well full in order to be able to nourish anyone else. And, you know, just go slow. Go slow with your parents. If they're afraid and apprehensive, then, you know, find somebody that they find palatable. There's a lot of great people out there like Elisabeth and I who are sharing really good information that might be Trump supporters, and your parents might like them more. So there is something for everyone, and there's an avenue for all of us to learn. And that is really why we are here. Like I said in the beginning, we are here because we want to teach you to fish. And the way that you fish is with knowledge. And who this lovely lady, this nurse, I always want to call you Dr. Emac, but she's not a real doctor. She's a nurse, even better. Because aren't the nurses the ones that really keep everyone alive? You know, I've noticed that it's really the nurses that really do it.
Look at my favorite book. You know, you pay me to read this stuff, right? Okay. You want to see even like this?
I'm like, what is this Bible that she's holding? Look how excited
This
she
is
is.
called gerontological nursing. So now you get to see a day in the life of EMAC, right? So like I read this stuff, and this is all the principles
She like literally reads it cover to cover, and that's just one of the 12 books that she's reading right now. So honestly, if you need some help with your parent, and you need some help with your loved ones, and you need some help with yourself, please, in the feed are all the ways to connect with holistic caring and with Elisabeth. Here's some more intense in literature that she's read.
Well, right. I've read this cover to cover many times. This is the Tikkun Olam. It's the collective in Israel that is doing all of the research for medicinal cannabis in Israel. And these guys have published, if you look at this table of contents, studies on all of these conditions, right? And so all of these conditions are what we use cannabis for. And this is preclinical, which means that it's in rodents and cell cultures, but also they have some clinical studies in here too, where they are working with a patient population. So, you know, I read, you know, the traditional conventional medicine, and then I read all the cannabis research, and that's how I made this. Like, this is my own book.
That is so awesome. And it's not just, here's the deal, you guys, like this is obviously a very dear friend of mine, and I love her very much. Okay. And I really appreciate not only the body of work she's put together, but also the team of practitioners that she's put together. So it's not just her and her big brain. There are a whole bunch of cannabis nurses that are working with her that are kind of all over the place and are able to help you navigate the things and the questions that you don't have. So you're not out there alone. You don't need Facebook groups. You don't need to be Googling what it is. All you got to do is just come right here. We have the polls, we have the bait, we have the ways to get you to the biggest fish in the pond of knowledge, so you can make the very best choice that you can make.
Well, and going back to this, you know, the cannabis health coach licensing program, and what's in here is, you know, not only the entire course and the course platform that I've built for healthcare practitioners, which teaches you literally everything you need to know, but it gives you a toolkit, which gives you all that you need to run a business, monthly masterminds, and a business and operational support system. And
all of our healthcare providers that are listening to us right now, you know, like drop in, because we are out to create an army of you. You know,
right. And you want to hear something funny.
Exactly. The more, especially the more people we can we can educate in allopathic medicine. You know, what you all know is like pharmaceuticals, doctors, nurses, you know, where you go to the Kaiser, whatever. The more information we can get about plant-based medicine into that arena, the healthier you're going to be, the longer your liver is going to last, the better you're going to look, and the more enjoyment and pleasure you're going to have out of your life. So is there anything that you want to say in closing there, Miss?
I have one more book because you're making me laugh because we were talking about seniors and this one and gerontology nursing, and then we were talking about cannabis research and this one, and I've read all of those, and now look at this. Cash pay healthcare, how to start, grow, and perfect your business. This is a different kind of a practice, right? And so I belong to the Academy of Integrative Health and Medicine. One time I was there at a conference and I saw this book. I heard him speak, good guy, but none of this is covered in insurance because you know what? Insurance is run by pharmaceutical companies,
Right.
all the biotech and all that, right? And so people that want natural healing and clinicians like me that know all this stuff have to pay out of pocket because it's a really incredibly perverse system. And I'm going to go back and change this when I can change policy in this industry. But we have to get insurance coverage for endocannabinoid system counseling, functional medicine counseling, and how these medicines work, and then covering some of these botanical formulations that can be consistent, standardized, reliable, and formulated with a good
You just
manufacturing.
created a whole bunch of jobs in the lobby industry, so that's wonderful. So all of you, please share us. We love being shared. We want all of you. We want to reach out and touch every single one of you. So share us because there's lots here for a lot of people who could really use and benefit from this information. Holisticcaring.com, firebirdtouchtherapy.com, Blue Buddha CBD. There's so many ways to reach us, and we are happily to be available for you. Elisabeth has an amazing team of nurses that can help you out and help you sort through these hard things with your family and what exactly are the best products. And also just one last thing I just have to say, it is just a freaking plant, okay? So it will not hurt you. You will not die from using it. You cannot overdose from using it. Nothing bad will come from it. The worst experience anyone is gonna have is they're gonna feel a little dizzy, a little nauseous, and they might, if they take too much, they might throw up and then they're going to pass out for 12 to 15 hours. That is as bad as it's going to get for you. So come on, folks, super easy. And as my father used to always say, the higher the truth, the simpler the action. And there is nothing more simple than the 5-finger healer.
Very cool.
We got anything else?
Well, yeah, and thank you for saying please share about us because it's difficult to work in this industry because it's hard to share what you're doing like on social media because they censor things. And I only go to Facebook like once a week anyway. Like on Sunday afternoon, I'll go in there because I'm reading all these books.
Okay. So Elisabeth is only going to Facebook on Sunday afternoon because it's in her calendar as the time that she's allowed to do social media for 45 minutes.
Yeah, because I'm not a social media person.
To 2:45. All right. Well, we're going to say goodbye to y'all. We will see you next week. Hey, you know what we would really appreciate is you letting us know what you would like to talk about, what you would like to hear from us. The more feedback you give us, we welcome your feedback, good, bad. Of course, we love pets and kudos, but whatever you need to say. And also, more importantly, the most thing that we want to know is what topics are interesting to you and how can we feed you?
Yeah.
That's it. All right. Well, we'll see y'all later.
Tikkun Olam, heal the world. God bless. Visit us at Holistic Caring and let us know how we can help